Hello, my name is Alyssa Peck. This is my presentation on pertussis. It's also known as the whooping cough. This is for Dr. Joyota's Physiology, Section 32238, Spring 2023. So pertussis is a respiratory infection caused by the bacterium Bordetella pertussis. It is commonly known as whooping cough. A little history about the disease. The first documented outbreaks were described by Guillaume de Belliot in the 16th century. The bacterium, however, was not isolated until 1906 by Jules Bordet and Octave Gengu. During the 20th century, pertussis was one of the most common childhood diseases and major cause of mortality in the United States. So a little bit about the morphology of the pertussis bacterium. It is gram-negative. It can be rod-shaped, coccoid, or ovoid. It's very small in size, approximately 0.8 micromillimeters by 0.4 micromillimeters. It's encapsulated and the bacterium does not produce any spores. So here on the screen, we see a microscopic view of it. And over here, we have a more diaphragm version. So we see the plasma membrane, the cytoplasm, the cell wall, DNA, flagella, ribosomes. A little bit about the reservoir, where it's found. So it's found in humans, adolescents, adults, school-age children, infants, babies can all carry the disease and pass it along. No other vector is known to transmit the disease. So you're not going to get it from our little furry friend here or this pesky little creature that bites us. Animals do not carry the disease. You're going to get it from these cute little babies and kids and other humans. A little bit about the pathogenesis of the bacteria. So the bacteria attach to the cilia of the respiratory epithelial cells. They produce toxin. The bacteria will produce toxins that paralyze the cilia. That interferes with clearing of pulmonary secretion due to inflammation. It's primarily a toxin-mediated disease. And what I mean by that is major toxins contribute to the pertussis infection and disease. So we have adenylate cyclase toxin, hemolysin, and tracheal cytotoxin. Pertussis toxin is a multi-subunit protein toxin that inhibits host G protein coupled receptor signaling. And here we just have a picture of our respiratory tract. So as we see, the cilia line the respiratory tract, their hair-like projections line the primary bronchus. They remove microbes and debris from the exterior and interior of the lungs. So when we paralyze the cilia, they're not able to do their major job, which is very important, clearing secretions and just being a barrier. Some virulence factors. Adhesions produced by B. pertussis allow the pertussis to bind to those ciliated epithelial cells, as I mentioned, in the upper respiratory tract. A secreted AB5 type protein, exotoxin called pertussis toxin, is involved in the colonization and establishment of the infection. So this plays a major role in starting the pertussis infection. It's the main cause or main fighter in the disease. And then we have adenylate cyclase toxin, CYA. is also a major colonization factor, especially for the early phase of infection. So here we just have another diagram showing us the different toxins. So here we have, let me get my pointer out. Here we have pertussis toxin that stimulates cough reflex. It also stimulates lymphocytes. Adenylate cyclase, inhibition of polymorphonuclear neutrophils, which can cause secondary pneumonia, which also leads to damage to the respiratory epithelium. Then we have the B. pertussis toxin attaching more damage to the respiratory epithelium. And we see other things here, the tracheal cytotoxin, more damage to that respiratory epithelium. So it really just damages the epithelium in many different ways. A little more about the mechanism of action. Kind of what I've already said, more summed up. The pertussis toxin inhibits host G protein coupled receptor signaling, and PT likely induces leukocytosis. Pertussis toxin utilizes a retrograde transport pathway through the Golgi complex and endoplasmic reticulum to gain entry to the cytoplasm. And then CYAA primarily targets phagocytic cells to inhibit their antibacterial activities. So it's going to stop our good bacteria from fighting off the pertussis. And then adhesion factors allow attachment to ciliated cells through microtubule assembly, lipid raft integrity, and the activation of a tyrosine kinase mediated signaling. So transmission of the disease, it does have some airborne properties, so respiratory droplets, which would be droplets in sneezing or coughing. They can't transmit very far, so you do have to be fairly close to the person, but that's its main way to spread. Saliva, so sharing, picking up your grandma's drink or sister's drink that is infected would be passed that way. And then skin to skin contact. It doesn't really live on surfaces too much. Skin to skin contact is more going to be like you sneezed, covered your mouth with your hand, and then you went and shook someone's hand. And then here we just see a girl blowing out the birthday candles would definitely transmit and spread the disease. The boy spreading, sneezing, using his hands instead of his elbow. So all that, and then he's going to go touch things and touch other kids as well. That's all ways the disease is easily transmitted. And another reason it's very highly contagious. So signs and symptoms of the disease. So you have runny or stuffed up nose, low-grade fever, usually less than 100.4 degrees Fahrenheit, a high-pitched whoop cough, which in my next slide I will show you a video because I tried to make a whooping cough sound and I wasn't very good at it. But it's a high-pitched whoop sound after a coughing attack. Apneas, which is temporary sensations in breathing. Usually those are characterized by pauses of 20 seconds or more in breathing. It's very common as well when the infant or a person infected is sleeping that they have these apneas, which is even more dangerous. Cyanosis, a bluish discoloration of the skin resulting from poor circulation or inadequate oxygenation of the blood. So just not breathing enough, your blood's not getting enough oxygen. That could also be shown in a arterial blood gas. Your PaO2 would be low. And then poor circulation. And then inability or difficulty clearing secretions. So especially in infants, they're not able to cough and blow their nose like a child or adult can. So those secretions are just sitting there in their airway, clogging them up, making it harder to breathe, and then also growing infections as well. So diagnosis. That classic distinguished whooping cough and other typical signs and symptoms that are just typical of a common cold, runny nose, fever, headache, weakness, fatigue. Those are your typical signs and symptoms. A polymerase chain reaction, a PCR test, is a molecular technique used to detect DNA sequence of the Bordetella pertussis bacterium. It does not require live bacteria in the specimen. It's a rapid test with highly detectable sensitivity. And then you can do blood tests as well. So blood tests aren't really as common, but they can check for detectable levels of the pertussis IgA antibody. However, the preferred method is going to be your PCR test, or a respiratory culture will be more accurate and easier and faster. A little bit about the PCR test. So they are a fast, highly accurate way to diagnose certain infectious diseases and genetic changes. The tests work by finding the DNA or RNA of a pathogen or abnormal cells in the samples. A lot of people learned that word PCR tests the past 2 years over our COVID pandemic. So COVID tests, that's how 90% of them are done, is the PCR test. When you go to Walgreens or you go to Rite Aid or even urgent care, most facilities are just doing that PCR test. It's also another way they diagnose RSV very quickly as well in the hospital setting. So like I said, the first diagnosis method is usually the PCR test. Second would be a culture, and last would be a blood test, which isn't very common, but they still can test through the blood. So treatment. Treatment, you can have your antimicrobial agents, azithromycin, clarithromycin, erythromycin, trimethoprim sulfamethoxide. No, I'm terrible at pronouncing those words. Keeping the airways clear is really important, as I mentioned. This can often require suctioning to clear the airways of mucus. This will most likely be done in a hospital setting, and like I said, for like infants, because adults and children can blow their nose and cough stuff up, whereas the infant isn't really as able to. So a lot of times they will commonly nasal suction the baby or infant, and they do that with a French catheter. They would lube up the catheter, insert it into the nostril to mid airway, and then pull back and repeat as needed. It is somewhat invasive, so they only want to do that if necessary. Monitoring breathing and giving supplemental oxygen if needed. So just if you're at home, you could monitor with the pulse ox. You're going to measure your SpO2. That's what the hospital would measure as well. If you do need supplemental oxygen, it'd usually be a low amount on a nasal cannula, like 2 to 4 liters if needed. Preventing or treating dehydration, just keep drinking those fluids. And in a hospital setting, if they were unable to hold the fluids down or take fluids in, they could put them on an IV drip to get those fluids they need. And it's real important to treat it in the early stages. Once it gets to that whooping cough, really infected stage, it's going to take longer, and the pertussis can last for 2 months, 3 months. Whereas if they catch it in the early stage and you treat it right away with those antibiotics, you have a much better chance of nipping it in the butt before it progresses. So prevention of it, of contracting the disease. Obviously, good health habits, washing your hands frequently, covering your mouth when coughing or sneezing, and like I said earlier, covering it with your elbow or a tissue, and then washing your hands. Staying home when you're sick, don't let your kids go to a birthday party, no matter how bad they want, if they're coughing and hacking up. Just want to keep them home so they don't spread the infection more. There is vaccine, a very common one, which I'm going to go over a little more. That's going to provide immunization, which is our Tdap and our DTaP. So going a little bit more over those antibiotics. The DTaP is the one that is given to infants and children. The CDC recommends 5 doses, so 1 at 2 months of age, 1 at 4 months of age, another at 6 months of age, another one between 15 and 18 months of age, and then 1 at 4 to 6 years. So 5 doses, it's quite a bit, but it's definitely something that needs to be done, and I think you have to get it to even take your kid to school, so it's not really a negotiable. Tdap is a single dose. It's anywhere from ages 11 to 18. The preferred age, though, is 11 to 12 years old. Now, both Tdap and DTaP protect against the same disease, but at just different ages. So, in case you're unfamiliar, the DTaP, it's going to protect against tetanus, pertussis, and diphtheria. They also recommend preventative antibiotics if someone in the household has it. So if you get a 6-month-old in your house that comes contracted with it, they might recommend you give antibiotics to your 3 or 4-year-old as well as preventative measures. Immunity. So childhood immunization and universal immunization for all infants will reduce likelihood of being infected and reducing the number of overall cases. Booster shots are recommended for people aged 19 to 65. There was a small outbreak, just on a side note, this year, and actually last week there was one in Ohio. There's 33 cases alone in Ohio reported to the CDC, which was a little interesting. This year alone, the CDC within the United States has found 1,200 cases, and last year there was only 800 cases. So there has been a little jump this year compared to last year, considering we're only in May. Part of the reasoning they think behind that is people aren't getting vaccinated at all, or people aren't completing the vaccination that is required, so the full 5 doses. I just thought that was a funny picture, knocking out the virus, building that immunity for the world. So I hope you enjoyed my presentation on pertussis, whooping cough. And you know what? I don't know why my video didn't show, so I'm just going to play one really quick so you can hear the whooping cough sound. So you should be able to just hear this slightly in the background. So as you see it has that real distinguished cough. You can hear that whoop at the end, that high-pitched gasping for breath sound. So thank you. Hope you enjoyed the presentation.